The healthcare debate now in the hands of the U.S. Senate. Now, we told you all about Republican efforts to repeal and replace Obamacare, but how will that new plan affect you? KXLYanswers Caroline Rourke working for you, breaking down that proposed American Health Care Act. Caroline?
I know I had a lot of questions today, so it wouldn't be surprising if a lot of you did. We asked you all on Facebook, what do you want to know about potential changes to your health insurance? Here's what you asked us, and here's what we found out. Let's start with the big one. Will people lose coverage? Yes. How many is what's unclear. When the Congressional Budget Office reviewed the original plan, they estimated that 24 million people will lose coverage in the next 10 years. They haven't had a chance to review it since changes were made. Next, you asked, who will be most significantly impacted? Folks on Medicaid and people with low income. The AHCA could cut $880 billion from Medicaid, and federal funding provided to expand the program will phase out by 2020. The insurance marketplaces set up by the ACA will stay around, but they'll be a little bit different. The Obamacare subsidies that help low-income folks buy health care will be tied to age instead of income. Here's another big one. Under the AHCA, am I required to have health care? No. That was one of the biggest GOP criticisms of Obamacare, and they've made good on promises to change that. The AHCA takes away the tax penalty for not having coverage, but the cost of a new plan could surge if you go without insurance for more than 2 months. Another viewer question, what's the deal with pre-existing conditions? You've probably seen a lot about these in the news lately. The AHCA does not eliminate the rule that protects people with pre-existing conditions, but it does weaken it. Before Obamacare, insurers could deny you coverage if you had one of a number of conditions that includes things like cancer, diabetes, even asthma. The AHCA has an amendment that would allow states to file waivers, allowing them to charge patients with pre-existing conditions more if that state meets certain requirements. Whether or not states will take that option is one of the bigger unknowns of this new plan. But some Republican representatives were concerned by that, and a new provision was included to create an $8 billion fund for patients whose premiums or out-of-pocket costs are affected by that amendment. The Los Angeles Times broke it down this way. If you're nearing retirement age, you have low income, and you live in a high-cost area like Alaska or Arizona, you might have a hard time finding affordable coverage if Obamacare is replaced. If you're young, with higher income, and you live in areas with lower premiums like Massachusetts or right here in Washington, you actually might get more help underneath the new plan. But that, of course, is all contingent on whether or not the bill, as it exists right now, passes the Senate. This is a bare-bones breakdown, and we tried to get into even more specifics on our website. You can check that out at KXLY.com. Reporting in studio, Caroline Rourke, KXLY4 News.
Thank you, Caroline.